Hi, everybody. The first topic in Unit 3, Topic 3.1, is about intercultural communication. Culture is really, really important in healthcare, and you're going to see a more emphasis on it as you spend more time in healthcare. When I first started in healthcare, we really didn't concentrate much on cultural differences, cultural awareness, but as I've progressed through my career, it's definitely become more to the forefront, and healthcare facilities are concentrating a great deal on it. So much so that one of your assignments, first assignment, is about culture. I want you to go and research a culture you're unfamiliar with and then present it in a presentation setup of your choosing, as long as you get approved by me. So let's talk about intercultural communication. So, what is culture? Culture is a complex social concept that encompasses socially transmitted communication styles, family customs, political systems, and ethnic identity held by a particular group of people. Primarily learned and transmitted through family and other social institutions, from generation to generation, develops from customs and beliefs. Culture is a strong determinant of social behavior. I'm going to go through some key terms that are associated with culture in the next few slides. So, multiculturalism, a heterogeneous society in which diverse culture worldviews can coexist with some general characteristics shared by all culture groups. Canada is a great example of this. We have so many different cultures in our country and all live harmoniously together. So that's a multicultural country. Subculture, a smaller group of people living within the dominant culture who have adopted a cultural lifestyle distinct from that of the mainstream population. So there's often differences between the subculture and mainstream. Example, in our area, we have an Amish community, and their culture is very different from that of the mainstream population. Ethnicity describes groups in which members share a cultural heritage from one generation to the other. It's an important aspect of one's social identity. Ethnicity may be a common religion, but not a common skin color, not necessarily. Just because there's the same skin color doesn't mean they share the same ethnicity. Look at our Asian population. We have Japanese, Korean, Vietnamese, etc. Ethnocentrism, a belief that one's own culture should be the norm because it's considered better than others. This is not a good thing. Other cultures judged as inferior. We've seen this happen in history over and over and over. Hitler's regime, 9/11 attacks, the KKK. So these people live with a very narrow mindset. Cultural relativism. Each culture is unique and should be judged only on the basis of its own value and standards. Ideally, we would like all cultures to be judged on the basis of their value and standards, and all of them stand equally together. Culture diversity, variations among cultural groups, physical and behavioral differences that are obvious, language and mannerisms. If you look at India, even though they're all from the same country, there's very, very many different sects, and so they're all a little bit differently. Less obvious differences involve spiritual, religious, political, social, or communal beliefs and values. The key is that even though we may not understand a culture, we need to respect their culture. Acculturation. A person from a different cultural group learns and adopts cultural norms of the dominant culture. Physical acculturation occurs first, so behaviors and languages appear. Often you'll see clothing change, the way they dress changes. Then emotional acculturation, higher socioeconomic status, social support, education facilitates the process of acculturation. It's a socialization process. Immigrants often adopt a Western culture once they get to our country, so they're going through the process of acculturation. Assimilation is a gradual process by which a person belonging to one culture adopts the common behaviors, customs, values, and language of the mainstream culture. So again, immigrants go through this process. And usually by the third generation, people may have little knowledge of their original language and traditional practices, which is sad. Intercultural communication, conversation between people from different cultures, can be very challenging, primarily to share meaning, develop relationships, success, common understanding, and inclusion of issues and values, retreatment. It can be quite difficult when you're communicating with someone who doesn't speak your language. Language barriers are fundamental barriers to effective healthcare. Understanding vocabulary and grammar is not enough. Requires knowing what to say and how, when, where, and why to say it. You're not always going to do exactly what is perfect. And, just the fact that you're trying and you respect what they're trying to tell you. Understanding nonverbal behavior is a dimension of intercultural communication. Many cultures don't make eye contact, so you need to be aware of that. They have a bubble around them, a safe space. You don't invade that. Many cultures, you don't hug the women, you don't touch the women. As a white culture, it's sort of invading their privacy. Cultural competence. We all strive to have cultural competence. Culture behaviors and attitudes integrated into everyday practice, which enables them to work effectively in cross-culture situations. Ideally, we should all possess cultural competence and be able to work amongst many, many different cultures. We understand and respond effectively to the rich values, beliefs, customs, and symbols of people of other origins. Now, it is unreasonable to think that we should know everything about every culture, but again, you just need to respect it. Culture diversity in healthcare. These are just some of the areas where some cultures may differ. Nutrition and diet, values, right versus wrong, perspectives on health, illness, and death, hearing about and discussing negative health information, decisional authority. Often decisional authority is the senior man in the family. Use of advanced directives, child-rearing practices. I remember when I was laboring with my first child, the person beside me was a different ethnicity, and she just wailed, and I came to understand later that that's just how their culture deals with that kind of pain. Health disparities. So does culture affect health? You betcha. There are definite health disparities depending on what kind of culture you believe in. So inequality in relation to access, screening, and level of care. And it may not be that the health care is not available. It may just be that they don't access it. Minorities receive lower level of care, resulting in increased mortality and morbidity rates. Increased immigration requires nurses and healthcare professionals to put special focus on the role of culture. They often don't trust the healthcare system. They have fundamental cultural differences in health beliefs. The language barrier is huge, and often there's an economic barrier. So even if you give prescription, they may not be able to fill it. Culture and illness. Language of illness varies significantly from culture to culture. Cultural patterns shape health-related beliefs, attitudes, values, and behaviors. If health recommendations conflict with the client's worldview, they're not going to listen to you. They're not going to follow your suggestions. We need to understand their health traditions and kind of incorporate them into what we're trying to teach. Culturally diverse care. So how do we build that? We build rapport. So examples. So same thing as you would normally do. Address them by their name. And if unsure, if you can't say their name, ask them how to say it. Speak clearly. Validate what you hear. So ask them to repeat it or say, this is what I've heard. Is that correct? You'll need more time. Definitely, if you're dealing with a patient who doesn't speak the language you speak, you will need more time. Use your active listening skills to explore their culture. Always ask permission to touch them. Assess through cultural lens. Communication issues. Role relations. Some cultures won't question health professionals. They view them as a health authority. However, even though they agree with you, they may not follow your recommendations. Family involvement. Does their culture have a designated decision maker, either chosen by age or gender? And again, typically it is the older male. Time orientation. Some cultures are not clock watchers. They need to be flexible with appointments. They may not follow drug schedules. They just kind of are a little bit more flexible in their life. So how do we speak more with English speaking clients? So speak slowly, not loudly. Face a patient to make appropriate use of gestures, pictures, and facial expressions, and closely observe the patient's responses. There's always a picture board somewhere that you can grab. Avoid idiomatic expressions that may be difficult for the patients to understand. And again, use commonplace language. Do not clutter your talk with unnecessary words or information. Too much information, just give the bare bones. Speak in simple, declarative sentences, and especially the situations that you'll be dealing with. You've got to be straightforward, like no mincing words. Remember to paraphrase and summarize often. So, take what they've said, shorten it up, and feed it back to them and see if that's correctly if what you heard is what they actually said. Check to see that the patient understands the concept behind the words. Avoid questions that can elicit a simple yes or no answer because they don't let you know that the patient's actually understood what you've said. And finally, if you needed someone to help you, get an interpreter. The use of interpreter is a great way to decrease frustration of the client and enhance the nurse-client or healthcare professional relationship. Not a family member if possible. Sometimes patients aren't free to say what they want to say if they are in front of a family member. Confidentiality is huge. Look at the patient when speaking. Make them the priority. Pause for translation. It's really hard to do, actually. I have a hard time waiting, but I find interpreters, and I know they're great benefit, but I find the process so long. Ask translator to clarify and validate what you've heard. Now, many of us do not think of poverty as a culture, but it is. And health disparities are clearly tied to poverty. Just as they are to other cultures, there are severe health disparities with those people that are suffering from poverty. Emerge department is their primary resource of healthcare. Crisis-oriented care. So they don't come to Emerge until they actually need it and they're in an emergency situation a lot of time. Cost of medications and treatments they cannot afford, so their chances are they're not going to follow your treatment. And they distrust healthcare systems, much as the same they do with the police, etc. Respect for human dignity. They are people, and they should be given our respect. They don't go to family docs. Care strategies require a proactive, persistent, client-oriented approach. Empower the poor to take small steps if most effective. Give them non-judgmental care, which leads to the respect for human dignity. So these are just some of the things, some of the terms and concepts that surround cultural communication. And I hope this was helpful. So on to topic 3.2.